Hello everyone, and welcome to the HacettepePathology.com Case of the Month series. And this month I'm going to present an oral tumor in a male in his 40s, and we had the clinical information that this patient had an oral mass several years ago, excised, but we don't have the result. Here in this, and this is a recurrent mass, and we have 3 biopsies from different time lines, and here, this is the most interesting one. Is we had this polypoid mass resembling granulation tissue with the erosion of the squamous epithelium. Here we have some squamous epithelium here, and here again some hyperplastic squamous epithelium, and here again with an exudate. We see exudate. The polypoid mass is covered by an exudate, and here again this is the second section. And when we go in high magnification, here we don't see any dysplasia in the squamous epithelium. However, in the granulation tissue, we have these vessels, but we have some ugly looking cells within those granulation tissue. Here these cells, some of them has smudgy nuclei, but some of them are clearly hyperchromatic and pleomorphic cells, just laying down, and some of course some mitotic figures here. And this is in outside clinics, this is referred to us as granulation tissue. Here again a mitotic figure again here. And we have also we have seen some spindle cells here among those hyperchromatic cells. Many of the cells are looking like achromatic spindle cell morphology. Here again. And again another biopsy. In another biopsy they have found, this is again, we have bacteria here, exudate, and we have this edematous areas, and here we have a cartilage. Okay, it doesn't look so malignant. However, the presence of this cartilage within this context of hyperchromatic spindle cells is quite alarming for especially sarcomatoid carcinomas. And we again, I'm going to show you another biopsy with clearly atypical epithelioid cells with some, again, mitotic activity. Yes, here they are. So we have these mitotic figures and hyperchromatic large cells. Some of them are spindle cells, and again another mitotic figure here. So we have performed, of course, several stains like excluding melanoma and sarcomatoid carcinoma, we have performed Desmin, S100, Soxtan, and even the keratin 18 here. This is negative, as you see. Our cells, yeah, we don't have any staining for keratin, and P16 is also negative. But again, the sarcomatoid carcinoma or spindle cell squamous cell carcinoma here may not be positive for any keratins. Here, this is the staining for P53, which stains every single cell, every single malignant cells. Of course, we don't have, we have some cells without staining, which refers to the granulation tissue. But when you exclude the granulation tissue, each malignant cell stains with this P53. So I didn't consider this staining as a heterogeneous mosaic pattern, but I thought that this is like full house mutant type P53 staining, and we diagnosed this case as, again, we have also some positive cells within the cartilage, so we called this tumor as granulation tissue like sarcomatoid carcinoma, and the name is tossed by Dr. Abbas Egemi with some 10 or 20 tumors which occurred in this head and neck region, especially in the larynx. So these cases are usually seen in the elder population with heavy smoking, and polypoid mass should always make the pathologist to think of sarcomatoid carcinoma, even though keratins are negative. Thank you very much.